experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. The skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. 𝒂𝒐𝒏𝒈 fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, 𝒂𝒐𝒏𝒈 is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for ice pick and boxcar scars. Platelet-rich plasma, PRP, therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist can assess your specific scars and recommend appropriate treatments. Realistic expectations are essential. Most scars improve significantly, 50 to 75%, but are rarely completely eliminated. Severe, deep scarring might only achieve 30 to 40% improvement even with aggressive treatment. However, significant improvement is usually achievable and worthwhile. Timeline for scar improvement is measured in months and years, not weeks. After a laser treatment providing immediate dramatic improvement, additional improvement occurs over 3 to 6 months as collagen remodels. Multiple sequential treatments provide cumulative improvement over 6 to 12 months or longer. Cost is a consideration. Professional scar treatments are expensive. Laser treatments $500 to $1,500 per session, multiple sessions required. Microneedling is more affordable at $200 to $400 per session. Fillers vary based on amount needed. Insurance typically doesn't cover cosmetic scar treatment. Discussing cost with your dermatologist and potentially planning treatment over time is reasonable. Home care between professional treatments supports improvement. Proper sun protection prevents hyperpigmentation that makes scars more noticeable. Hydration and appropriate skincare supports skin healing. Some evidence suggests that certain topical ingredients like retinoids and vitamin C might provide modest scar improvement through collagen support, though these effects are minor compared to professional treatments. Scar appearance often improves naturally over years. Post-inflammatory changes gradually fade. Scars that seem severe initially might improve significantly over 12 to 24 months even without treatment, though active treatment accelerates improvement. Guide 32. Environmental and occupational factors influencing acne. Acne development isn't purely internal. Environmental and occupational factors significantly contribute to breakouts. Understanding these external factors allows you to modify your environment and workplace practices to support.
Cố gắng một xíu nha em. Thấy chỗ nào không thoải mái thì nói chị ha. Nãy em đi Grab qua hay tự chạy xe qua?
Grab chị.
Ở nhà có dùng sữa rửa mặt không em ha?
Có chị.
Có bôi thuốc gì không em? Chỉ rửa sữa rửa mặt thôi. Nghe nặng quá đây chị nè. Cố gắng một xíu nha em. Dưới này da nó mọng nên nó hơi đau chút. cái đuôi này đây 4, 5, 6 4 mấy Yên ở đây nha.
Lúc này chỉ là mụn ẩn ban đầu thôi, xong rồi con để lâu á con không có xử lý à. Để nó thành một cái nốt viêm rồi đây. Đó, vậy là xong, trống rồi nè. That's it. Thôi cô đổi chỗ nha, đổi chỗ ở đây, đổi chỗ ở đây. cố lên. Sắp xong rồi con. Chiếu ra thôi. Quá trời mụn này.
sống
Lấy tiếp được nữa không con? Lấy tiếp được nữa hay nghỉ? Hả? Lấy tiếp hay nghỉ? Hả? Nghỉ hả?
Treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice-pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13, Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily.
Welcome, and take a moment to breathe deeply. Let yourself relax into this peaceful space where we'll explore chemical exfoliation, specifically AHAs and BHAs. The word chemical can sound scary, and acid might make you nervous. But chemical exfoliation, when done correctly, is one of the gentlest and most effective ways to reveal brighter, smoother, healthier skin. There's nothing to fear here, only understanding to gain. Let's begin by understanding what exfoliation is and why your skin needs it. Your skin naturally sheds dead skin cells in a process called desquamation. Every minute of every day, you're losing thousands of dead cells from your skin's surface. This is normal, healthy, and necessary. These dead cells are replaced by fresh, new cells that travel up from deeper layers. When you're young, this process happens efficiently. Dead cells shed easily, and your skin looks fresh and radiant. But as you age, or when various factors interfere, this natural shedding process slows down. Dead cells accumulate on your skin's surface, creating a dull, rough texture. Pores can become clogged. Your skin may look tired and lackluster. Exfoliation helps remove these accumulated dead cells, revealing the fresher, brighter skin underneath, and encouraging your skin to maintain that healthy cell turnover. There are two main types of exfoliation: physical and chemical. Physical exfoliation uses scrubbing particles or tools to manually remove dead cells. Chemical exfoliation uses acids or enzymes to dissolve the bonds between dead cells, allowing them to shed naturally. Today we're focusing on chemical exfoliation, specifically the two main categories, AHAs and BHAs. Let's start with AHAs, alpha hydroxy acids. AHAs are water-soluble acids derived from various natural sources. The most common AHAs in skincare are glycolic acid from sugarcane, lactic acid from milk, and mandelic acid from almonds. Each has slightly different properties, but all work on the surface of your skin. AHAs work by weakening the bonds that hold dead skin cells together on your skin's surface. Think of it like dissolving the glue that's keeping those cells stuck. Once the bonds weaken, the dead cells can shed away naturally, revealing the fresh skin underneath. This surface exfoliation brings multiple benefits. First, it improves skin texture. As dead cells are removed, your skin becomes smoother, softer, and more even. Rough patches diminish. Your skin feels refined. Second, A's brighten your complexion. That dull, lifeless look often comes from accumulated dead cells blocking light reflection. Remove those cells and your skin immediately looks more radiant, more luminous, more alive. Third, Oz can help fade dark spots and hyperpigmentation. By encouraging cell turnover, they help fade areas of excess pigmentation more quickly, leading to a more even tone over time. Fourth, AHAs can reduce the appearance of fine lines. While they won't eliminate deep wrinkles, regular use can soften fine lines by promoting cell renewal and improving skin texture. Fifth, AHAs enhance product absorption. When you remove that layer of dead cells, other products can penetrate more effectively. Your serums, moisturizers, and treatments work better on freshly exfoliated skin. Different AHAs have different strengths and characteristics. Glycolic acid has the smallest molecular size, allowing it to penetrate most deeply. This makes it very effective, but also potentially more irritating. Lactic acid is gentler while still being effective, and it also has humectant properties that help hydrate. Mandelic acid has the largest molecular size, making it the gentlest option, perfect for sensitive skin or beginners. Now let's talk about BHAs, beta-hydroxy acids. The main BHA used in skincare is salicylic acid. Unlike AHAs, which are water-soluble, salicylic acid is oil-soluble. This single difference makes it work very differently from AHAs and gives it unique benefits. Because salicylic acid is oil-soluble, it can penetrate into your pores, which are filled with sebum, oil. This makes it exceptionally effective for treating and preventing clogged pores, blackheads, and acne. It's like having a tiny cleaning crew that can work inside your pores, not just on the surface. Salicylic acid works by dissolving the debris that clogs pores, dead skin cells, excess sebum, and other buildup. It gently clears out pores from within, preventing and treating blackheads, whiteheads, and acne. Beyond its pore-clearing abilities, salicylic acid also has anti-inflammatory properties. This makes it doubly effective for acne-prone skin. It both treats the clogging that causes breakouts and reduces the inflammation that comes with them. Salicylic acid also exfoliates the surface of your skin, similar to AHAs, improving texture and brightness. However, its real superpower is that deep pore penetration. So how do you choose between AHAs and BHAs? If your main concerns are dullness, rough texture, fine lines, or hyperpigmentation, AHAs are your best choice. They work on the surface to brighten, smooth, and even your skin tone. If your main concerns are clogged pores, blackheads, whiteheads, or acne, BHAs are ideal. Their oil-soluble nature allows them to work inside pores where the problems originate. If you have combination concerns, perhaps some dullness plus some clogged pores, you might benefit from using both, though not necessarily at the same time. Now, let's talk about how to use AHAs and BHAs safely and effectively. Start slowly. If you're new to chemical exfoliation, your skin needs time to adjust. Begin with a low concentration, 5% glycolic acid or 0.5–1% salicylic acid, and use it just once or twice a week. Pay attention to how your skin responds. Some tingling is normal when you first apply acids, especially AHAs, but there should be no burning, no severe stinging, no lasting redness. If you experience these, the product is too strong or you're using it too frequently. Gradually increase frequency as your skin builds tolerance. You might eventually use acids 3 to 4 times per week or even daily depending on your skin's resilience and needs. But this takes time, weeks or months of gradual introduction. Choose the right format for your needs. Chemical exfoliants come in various forms: toners, serums, peels, and pads. Daily toners have lower concentrations for regular use. Peels have higher concentrations for occasional intensive treatment. Start with lower concentration daily products before attempting peels. Apply acids to clean, dry skin. Water can dilute them and reduce their effectiveness. After cleansing, wait a few minutes for your skin to dry completely, then apply your acid product. Wait before applying other products. Acids work best at a specific pH level. Give them 10 to 15 minutes to work before applying other products. This wait time isn't mandatory, but it optimizes results. Always follow with moisturizer. Acids can be drying, so proper moisturization after use is essential. This replaces any moisture lost and supports your skin barrier. Use sunscreen diligently. AHAs increase sun sensitivity by removing that protective layer of dead cells. You should always use sunscreen, but it's especially crucial when using AHAs. Apply SPF 30 or higher every morning. BHAs also increase sun sensitivity, though to a lesser degree. Don't over-exfoliate. More is not better with acids. Over-exfoliation leads to irritation, redness, increased sensitivity, and a damaged barrier. If your skin feels raw, looks shiny, burns when you apply products, or becomes excessively sensitive, you're over-exfoliating. Pull back immediately. Signs of proper exfoliation include smoother texture, brighter appearance, easier product absorption, and comfortable skin. Signs of overexfoliation include redness, burning, excessive sensitivity, shiny or tight skin, and increased breakouts. Be cautious about combining acids with other active ingredients. Acids plus retinol, acids plus vitamin C, acids plus more acids. These combinations can be extremely potent. If you use multiple actives, consider alternating them on different days, rather than layering them all at once. Who should avoid acids? If you have very sensitive skin, active eczema, rosacea flare-ups, or severely compromised skin barrier, acids may be too irritating. If you're on certain medications like Accutane, check with your dermatologist before using acids. Pregnancy and breastfeeding. Most AHAs are considered safe in moderate concentrations. Salicylic acid in leave-on products should be used cautiously and only in low concentrations, 2% or less. Always consult your healthcare provider. Let's discuss results and patience. Chemical exfoliation doesn't produce overnight miracles. You'll likely notice immediate smoothness after your first use, but significant improvements in texture, brightness, and clarity take time. Give it 4-6 weeks of consistent use before evaluating whether it's working for you. Some people experience initial purging when starting acids, especially BHAs. Purging means existing clogs surface more quickly, causing temporary breakouts. This is normal and usually resolves within a few weeks. If breakouts persist beyond 6 to 8 weeks, it's probably not purging but an actual negative reaction. Storage matters with acids. Keep them in cool, dark places. Some acids, particularly vitamin C combined with acids, can oxidize when exposed to light and air. As we close, remember that chemical exfoliation is a powerful tool for healthier, more radiant skin. Used wisely with patience and respect for your skin's needs, AHAs and BHAs can transform your complexion. But they require responsibility. These aren't products to use carelessly or aggressively. They're potent ingredients that demand understanding, patience, and proper sun protection. Take a deep breath in and release it slowly. Consider whether chemical exfoliation might benefit your skin, and if so, commit to using it thoughtfully and safely. May your skin be bright, smooth, and healthy. May you approach powerful ingredients with wisdom and care. May you find balance in your skincare routine. Thank you for this time together. Be well and be gentle with yourself. Welcome to this calm, peaceful space. Take a moment to breathe deeply. Today we're going to talk about retinol, perhaps the most powerful anti-aging ingredient in skincare. Retinol has a reputation. Some people swear by it. Others are intimidated. The truth lies in between. Retinol is incredibly effective when used correctly, but it requires respect and patience. Let's begin by understanding what retinol is. Retinol is a form of vitamin A. It's part of a family called retinoids. When you apply retinol to your skin, it converts into retinoic acid, the active form your skin cells can use. What makes retinol special is its ability to communicate with skin cells, telling them to behave like younger, healthier cells. Retinol increases cell turnover. Your skin sheds old cells and generates new ones, but this slows with age. Retinol speeds it up, revealing fresher, brighter skin. Second, retinol stimulates collagen